Good morning, good afternoon, and good evening, everyone. My name is Susie Campbell, and I am the Senior Monitoring, Evaluation and Research Advisor in Epidemiology at the SCI Foundation. I am speaking from Brisbane, Australia, so I would like to begin by acknowledging the traditional owners of the land from which I am meeting you today, the Turrbal people, and pay my respects to elders past and present. As the chair of the Schistosomiasis and Soil-Transmitted Helminths Disease-Specific group of the NNN, I warmly welcome you to our annual meeting. As you know, STH and schistosomiasis are often co-endemic, and treatments are often co-administered using drug delivery platforms such as school-based deworming. STH and schistosomiasis are also linked by key target populations for which donated drugs are currently available from the global drug donation programs through the World Health Organization. We are fortunate to have the STH Coalition and the Global Schistosomiasis Alliance, which reach a wide range of stakeholders interested in eliminating STH and schistosomiasis respectively as public health problems. Thus, the NNN Schistosomiasis and STH Disease-Specific group serves us as an important platform augmenting these coalitions to formally link the two diseases. Our primary objective is to share information among the NGO members and identify synergistic opportunities in the control of these two neglected tropical diseases. Our main communication is our face-to-face meeting, which is usually held annually as part of the NNN. COVID caused many disruptions in 2020, and with NNN having to move to a virtual platform for the annual meeting for the first time, we were unable to convene our annual disease-specific group meeting last year. So we are especially delighted that you can join us for our meeting and important updates today. This year, our meeting is a side event to the NNN, to which we remain integrally linked. We offer our utmost support to the conference theme of enabling a paradigm shift to a country-led response to deliver the NTD Road Map. And we do look forward to happier times when we can enjoy meeting you, our friends and colleagues, in person once more. I would like to thank Dr. Mike French from RTI, who was our outgoing chair last year. As the group was not able to meet, his tenure was completed without appropriate appreciation. So Mike, on behalf of us all, I thank you for your excellent work as chair in 2019-20 and the thought partnership you have contributed as we planned today's meeting. I also express thanks to Mr. Alex Jones, recently of RTI, who was our nominated vice chair for most of this year before he moved to a non-NTD position and had to relinquish the role. So further, I thank and introduce that Dr. Anouk Gouvras of the Global Schistosomiasis Alliance has stepped in at short notice in the midst of our meeting planning to become immediate vice chair, and whom will be our 2021-22 chair. Anouk's expertise, experience, and passion for these diseases is very evident, and I have utmost confidence in the forward momentum of the group. I also thank both the Global Schistosomiasis Alliance, in particular, Dr. David Rollinson, Dr. Anouk Gouvras, and Dr. Johannes Waltz, and the STH Coalition, particularly Dr. Paul Emerson and Mariana Stevens, for providing extensive assistance in planning and supporting this meeting. The GSA and the STH Coalition are bearing the costs of today's meeting, and for this and much else, we are truly appreciative. With much anticipation from the new WHO roadmap, we hope this meeting will be fruitful for all participants. We have an exciting agenda with updates from WHO headquarters on both schistosomiasis and STH from the focal points Dr. Amadou Garba and Dr. Antonio Montresor, followed by updates from the Global Schistosomiasis Alliance and the STH Coalition. With the new roadmap's strong focus on measuring progress, for the second half of our meeting, it is particularly topical to discuss country approaches to reporting on the schistosomiasis and STH roadmap targets towards 2030. We shall hear from Nigeria, Mali, and Tanzania, and we will then invite interactive discussion on how countries aim to report on the schistosomiasis and STH roadmap targets and what we as a sector can assist with. So, without further ado, it is my pleasure to introduce our first presenter, Dr. Antonio Montresor, the STH focal point at WHO Geneva. We will have time for audience questions after our first panel of presentations. However, I encourage you to add your questions to the chat function at any time. Thank you, and over to you, Dr. Montresor.
Thank you, Susie. Thank you very much, and welcome to everyone. I'm Antonio Montresor. I'm focal point for STH in WHO Geneva. I hope you can see my screen.
Yes, we can see your screen, Antonio.
Okay, thank you. So let's start immediately. First of all, it's not moving. Okay, so first of all, let's see some of the WHO documents recently published. We have, the first one is not showing. So we have, first of all, the one is not showing is something about the side effect of how to prevent side effect of administration of NTD drug. Is not only for STH, but it's for all the NTDs. Then we have the diagnostic target profile. That is something that has been developed by a group of working group in WHO, determining what is the profile of a diagnostic for STH, and something on strongyloidiasis that probably, as you know, is one of the next target from WHO in the area of STH. So let's see also which are the progress on the warming in the last years. So basically, we have assisted a very quick and rapid improvement of the coverage. We reached in 2019 almost 600 million children with 60% coverage. Unfortunately, because of 2020, you know, we are receiving now the report for 2020, and because of COVID, we have a drastic drop of this coverage, and both for preschool children and school-age children. This is in a way inevitable due to the reduction of the coverage of vaccination campaign, and also because the schools are being closed in many countries. So let's hope that from next year we start again to scale up and to improve the coverage in this globally. So these are the details about the past coverage have been reported in a weekly epidemiological record and in this publication that have been recently put on PLOPS NTD. So what are the progress on mobility control? Something to say is that we, from 2020, because of the new NTD Road Map, we are not focusing anymore only on coverage, but we are much more interested on the capacity of our intervention to reduce mobility. And just to give you what are the principle for the elimination of STH as public health problem. This is the natural progress of the disease. You start with few worms, and then progressively new infection, you get much more worms in the intestine. So the idea is that when we, first of all, when you have few worms, mobility is very limited. While when you have a lot of worms, of course, they cause a lot of mobility. So when we administer drug, what happened? We return this progression, and after 4 or 5 years, normally we have a sort of cycle between light infection and negative, because there is no time for the infection to become moderate and heavy intensity. In this condition, we don't have STH mobility, and this is what we aim with our intervention. So this is also what happened with a moderate heavy intensity infection after treatment, and over time we have a progression of the reduction that can reach really near 100% for all the 3 parasites. So we have clear group of mobility of STH. You know, there are people that are in a particular time of their life in which they grow up, they need to develop. For the children, and for the woman and the girls, especially, they are losing already a lot of blood with menstruation. And if they have an additional loss of blood through hookworm or other infection, they can go in a very critical situation. So this is why they are the 3 group at risk. And we are going quite well for preschool children and school-age children. We have reduced most of the DALI caused by this STH on this age group. We have very little success on women or reproductive age. Basically, we have the same amount of DALI loss that we had 20 years ago. So what are the planned activity for 2021-2022? First of all, we want to better target women reproductive age. We are developing this policy brief. It's still draft, but will be launched probably before the end of the year. It's together with UNICEF. And basically, we are trying to convince to a country, an endemic country, to adopt a minimal strategy, in the sense that, for example, we don't need to do a special survey for a woman or reproductive age, because whenever we have information about the children, and there is the children are living in a contaminated environment, in the same environment living the woman reproductive age. So we try to avoid the need of spending a lot of money to do additional survey. And then what we want to convince, at least initially, to use existing contact between the health services and the woman to provide some deworming. So such is HPV vaccination for girls, and or for women when they are attending postnatal and prenatal clinic, and also when they are accompanying their children for vaccination. We think that this simple strategy, without additional cost, we can cover a big part of the woman in need. So another point we are particularly focusing next year will be the adaptation of the intervention to the situation, epidemiological situation. You know that it's a very different situation if you have, for example, 15 or 20% prevalence if you are coming from year of drug administration, or if there's the equilibrium between the parasite and the host. Basically, if we stop to administer the drug at 20%, after several years, we have almost certainly a rebound to the, if this was the result of an equilibrium without drug intervention, this will remain the same. So what we have to do in this case, in the red case, we have to continue to administer the drug. Maybe we can reduce the frequency of drug administration, but to maintain down the prevalence and the intensity of infection. So we are organizing a regional seminar in September for all the region in different dates. And we also developing a framework for monitoring and evaluation that is in preparation for guiding the countries. Basically, what we are suggesting the country, if most of the country we have seen, when they start with once a year administration, after 5 or 6 years, they can pass to every 2 years. And the countries that are in twice a year administration, they can easily pass to once a year. This is most of the case, not all the case. We need to measure the impact of the intervention and then decide what to do. But it's what we see and what we also allow to reduce the number of drugs they are distributing. We are distributing and the country are distributing. So we are also developing a survey that will reduce the need of sample and the cost of the survey, therefore, basically using a geostatistical approach. The idea is that if we have the baseline epidemiological information, we know the frequency of control intervention, we know the coverage of the control intervention, and we have ecological information on the area and geolocalization of the school, we can reduce dramatically the sample size, selecting schools that are more informative, and then reduce dramatically the cost. And also, of course, the situation on sanitation is important. So we did some test on impact survey that have already been conducted, and basically we can reduce the number of schools and number of children. For example, this is, I think, from an example from Kenya, from 180 schools and 70 children per school to 69 schools and 30 children per school. So reducing dramatically also the cost. That is our target, maintaining the same accuracy of the result. So we are preparing with a manual on that. We are collaborating with a group in Lancaster, and we hope also to have a draft of the manual by the end of the year. So another final thing, we need to collaborate with all the partners. And I'm very happy to address most of our partners now. And WHO is just establishing a expert group that will be, we receive a lot of application for this expert group. We are now selecting, will be probably 15, 20 people. And then that will help us to work on developing this documentation, pretest, review, and finalization. But of course, people that is not in this expert group, very much welcome to participate to the finalization of these documents. I think that's all. Thank you very much.
Thank you very much, Dr. Antonio. That was very, very interesting. We shall move straight along to the schistosomiasis version from WHO also. And so I introduced Dr. Amadou Garba, the schistosomiasis focal point at WHO Geneva. Thank you, Amadou.
So good afternoon, good evening, or good morning, everyone. It's a pleasure for me to attend this NNN meeting and to present to you a quick update on schisto activities. First of all, I would like to recall the launch of the NTD Road Map on 28th of January. And this NTD Road Map is the document which is going to guide us for the 10 coming years with regard to NTD control and elimination. And this NTD Road Map is characterized by the new shift on impact assessment, country ownership, and also the cross-cutting approaches to help attaining the targets set for each disease. And the NTD Road Map is accompanied by some documents. Among them, you have the sustainability framework, the monitoring and evaluation framework, the also WASH strategy. And this list is not exhaustive. You have also the One Health Strategy document, which is about to be published, and other documents to come. So with regard to schistosomiasis, to the indicators for this new NTD roadmap, they are aligned with the Sustainable Development Goals indicators. And one in particular is to have the reduction of 90% of the people requiring intervention against NTD. So I think this indicator is very important. It's good to recall that large-scale implementation of PC for schisto started in 2006 for many countries, and we have this big scale-up. And until now, countries are using the same number of people requiring interventions for schisto in particular, despite more than 16 years of interventions. So we think that it's time really to look at this number and to conduct the impact assessment survey in order to have this reduction, because we think that many people are treated while they really don't need to be treated, because the disease, the prevalence of the disease is becoming very low in many areas. With regard to the target for schistosomiasis, so the first target of the NTD roadmap is to have the elimination as public health problem in all the 78 countries that are endemic for the disease globally. And the second target is to have the absence of infection verified in some countries. And we are expecting to have 20 countries verified for absence of infection in human in 2013. So some critical actions also have been identified to help reaching this target for schistosomiasis. And among them, we have the definition of indicators for morbidity, in particular, a new definition for the elimination as public health problem. And I think this important point is among the first, that the new Schisto-STH technical advisory group, which is going to be set up, is going to discuss. Now, with regard to the preliminary results of the preventive chemotherapy for schistosomiasis. So in 2020, we have the starting of this pandemic of COVID-19, which impacted on the MDAs in countries. However, WHO was able to provide guidance to resume on treatment and surveys. So for Schisto in total, we have 60.7 million people that have been treated globally in 2020, which is very low compared to 2019 treatment, which was 105.4 million people treated, with a coverage of 67.2%. So for 2020, the coverage in school-age children is 33%, and the coverage in adult is 14.8%. So we have a reduction of around 40 million treatments compared to 2019. So WHO has also released some publications. So we have the first one, which is the safety manual of NTD medicines, which focus on the safe administration of the drug, the pharmacovigilance, and also the management of the adverse event and serious adverse event. And also it provides guidance on how to deal with rumors and manage communication if adverse events occur during MDA. The second document is the TPP, or the target product profile for schistosomiasis, that have been just released yesterday. So it is available on WHO website. It's a document that has been developed with a technical advisory group chaired by Ivan Sikor for Schisto. So in this document, you have a TPP for MNE, but you have also the TPP to support transmission interruption and surveillance. We have also developed an app to identify the snails transmitting schisto. So this application is about to be released for contribution and testing by the community. So it's focused on the snail transmitting schisto to humans, but also we have some snails that are not transmitting schisto on this application. In terms of guidance, we are preparing the Schisto and STH MNE framework, which is in preparation. And we have also this new technical advisory group, which is going to establish, and we are planning to have the first meeting early October. And we hope first week of October we'll have this first meeting. And then last, we have the new Schisto guideline, which release is imminent, which is going really to focus on integrated strategy, combining PC to other interventions. It's going also to simplify the MDA with no treatment holidays. A new threshold is going to be also applied. And it also includes some guidance for verification of transmission interruptions. So this is, in summary, the quick update that I wanted to provide you. Thank you.
Thank you very much, Dr. Amadou. I think that we will all agree it is brilliant to hear the WHO updates the strategic priorities for schistosomiasis and STH. It is also very interesting, slightly sad, but very interesting to hear the preliminary impacts that COVID has had on our numbers last year. We shall move straight along. I can see that we have some hands for questions, but we'll just go first to updates from the Global Schistosomiasis Alliance and the STH Coalition, and then we'll have time for Q&A. So I'd like to now introduce Marianne Stevens, who is a Deputy Director at Children Without Worms, which is the Secretariat for the STH Coalition and the STH Advisory Committee. Thank you very much, Mariana.
Thank you, Susie, and good morning, good afternoon, and good evening to everybody. I wanted to take a few moments and talk a little bit about the STH Coalition and its journey forward. As you all know, the STH Coalition was established in April 2014 to unite, align, and coordinate the work of partners from multiple sectors to support the delivery of the WHO targets for global STH control. The STH works together to support country-level STH control, accelerate action to global issues, broaden partnerships, and multi-sectoral collaboration. And I think the others have spoken to the global pandemic and how it's really kind of provided an opportunity for all of us to pause and reflect. And so with that, the STH Coalition had an opportunity to reach out to partners last year to kind of check and see how all the NTD programs were doing as it relates to the potential of continuing mass drug administration. And so what we've decided to do was that to take an opportunity to learn from these lessons. And so over the next few months, the STH Coalition will actually conduct a very thorough landscape analysis with the STH Coalition, country NTD programs, the pharma donors, and other funding organizations. And our key focus for this landscape analysis will really to revisit our engagement strategy, review the membership and see who is missed, and then rebuild the task teams. And so we really look forward to everyone's participation when we start to reach out to everybody, and we continue to be thankful for all of your support. Thank you.
Thank you very much, Mariana. And that is brilliant to hear the consultation process and the refreshing and renewing that is going on within STH Coalition. I'd like to now introduce Dr. Anouk Couvras, who is the Director of Communications and Programs for the Global Schistosomiasis Alliance. Thank you.
So good morning, good evening, and good afternoon to everyone joining us today. Many thanks to the NNN and the Disease-Specific group for inviting me to give this short talk. The GSA is the convening and enabling platform for organizations and groups working on schistosomiasis control and elimination. The GSA platform can be used to look at common challenges and explore potential solutions together, some that can be taken forward through the GSA and some that may be in the remit of multinational organizations or partners or countries themselves. So how does the GSA work? The Alliance is managed by the small executive team, which oversees and supports the GSA working groups and work streams. Working groups and work streams, shown in blue, bring together relevant experts and stakeholders addressing specific challenges or barriers to schistosomiasis control and elimination. The working group outputs are aimed at accelerating progress towards the WHO Road Map goals and beyond. So the working group chairs and the GSA exec team develop an annual operational strategy, which is then reviewed by the GSA Advisory Board. The Alliance also has a network of GSA ambassadors who are the point of contacts in endemic countries. We had started this GSA ambassador program last year and sent out a call for expressions of interest. So ambassadors are either the schistosomiasis program coordinator of a country, or they are the schistosomiasis expert that works with that program or advises that program. GSA ambassadors highlight priorities and advise us on the direction of work for the Alliance. You can read some of the GSA ambassador profiles on our website, and you'll actually hear from two of the GSA ambassadors today, which is very exciting. So these are our working groups, which you can see in columns, and our work streams, which are in boxes. Each has a list of members, a dedicated email address, and a shared folder. Working groups are more formal with terms of references, whereas in work streams and community of practices are a bit more informal and are usually set up using a concept note. The autonomy of every organization and individual is respected, and all are welcome. So you can find out more about these by contacting me or looking on our website. We do operate through these working groups and work streams, but as a multi-stakeholder platform, we get requests from the schistosomiasis community on how the GSA platform can be used to address particular needs. And I wanted to share some recent examples of requests that have come from stakeholders and partners. So you can see, for example, we coordinated a set of core NTD meetings on operational research needs for monitoring and evaluation, and you can access that report through the link shown on this page. Working groups and work streams learn from each other. They discuss common challenges and develop resources to address these challenges. And I wanted to show an example from the diagnostic workstream that collected and collated information on current commercially available diagnostics into a communication piece. This is a live document that will be reviewed and updated. It is available on our website, and it is available in several languages thanks to the translation skills of members of the diagnostic workstream. Please note that these are not recommended diagnostics, they're just a list of commercially available diagnostics. Another output this year was that the research working group led by Dr. Justin Comguet-Nono and by Dr. Poppy Lamberton organized a key meeting, the Schistosomiasis Research Innovation Meeting, which showcased exciting research findings and research in progress from scientists worldwide. The topics were really far-ranging, from geostatistical modeling to novel biocontrol technologies, and also focused on promoting early career researchers. And we really did have great feedback on that particular meeting. There are various items that working groups are working on and producing. Unfortunately, I cannot highlight them all today. However, I did want to highlight an open consultation we have on engineering and water treatment practices with regards to schistosomiasis. It is a quick survey, and we'd love it if anybody involved in infrastructure, development and design, and water treatment in schistosomiasis endemic countries could actually fill this in. It would really help us identify what is known and what the gaps are. We also have a series of schistosomiasis focused webinars, which is done in collaboration with the International Society for Neglected Tropical Diseases. And you can watch the webinars and the recordings of the webinars on our website. And on the 22nd of September, there will be a Core NTD Research Links webinar on putting schistosomiasis precision mapping into practice, with presentations from Kenya, Tanzania, Cameroon, and Rwanda on how they implemented that fine-scale focal mapping of schistosomiasis, what were the challenges, and how did this inform their intervention plans. So the registration is now open, so do register for that one. Please do also look at the online resources and resource collections that we have. These are documents, protocols, manuals, booklets from across the schistosomiasis community, and they're grouped according to a specific theme. such as behaviour change or M&E. We hope to expand these, and we do welcome suggestions and feedback on them. So that's it from me. Thank you very much for listening, and I'm looking forward to our discussions. Thank you.
Thank you very much, Dr. Anouk. And we can see that you have placed a very large quantity of useful links in our chat. So please, everyone, make sure that you take the advantage to tap into these, and also please to do the engineering survey if you are able to for Anouk. Wow, what a privilege it has been to hear from some of our global experts. I'm certain you actually will have many questions for all the experts, and so may I now please ask all presenters if you can turn on your videos. And now we will very happily take questions from the audience. I'd like to just first of all reach out to Chad MacArthur. I saw that you had your hand raised earlier, just to see whether you would like to have the opportunity to ask your question, please. And please, if I can ask people if they have a question for one person in particular, to please make sure they indicate whom at the beginning. Thank you.
And I apologize, that was a mistaken push of the button.
That's okay. That's no problem at all. I note that there's been a number of questions in the chat about the WHO guidelines. That's generated a lot of interest. So thank you very much, Dr. Amadou, for confirming that that is due to be finalized later this month. I believe we have a question from Mohammed Bar. If you can please unmute and ask your question. Mohammed Bar, did you have a question? Okay. I will just check with our panelists if anyone has seen any question flags that I have missed.
I can, if Mohammed is not online, I could read out his question, because I think it's a useful one.
Thank you. Yes, please.
So the question from Mohammed was, Sierra Leone is planning to do an impact assessment for schisto next year. This new guideline will help the country to plan for the assessment and redefine treatment guidelines. Has the new guideline formally launched? And I think he's referring to the M&E framework for schisto, and it sounds like schisto and STH are together.
Yes.
Go ahead.
Thank you, Michael. I think the schisto guideline will be launched before Sierra Leone start the survey, and it will impact the survey and also guide the decisions that are going to come from the survey.
Okay, fantastic. And as a follow-up question, if I may, so that's the schisto treatment guidelines. Is there also the M&E guidelines? Are they part of the same document, or will they be separate?
They are separate. As I said in my presentation, we are currently working on the schisto and STH M&E document. So we have developed the outline, and we are going to engage in, I would say, discussions with all of you in order to develop this document. And it is among the critical questions that our new STAG will have to discuss.
Thank you.
Lovely. Thank you very much, Dr. Amadou. And greetings from Brazil, who are also indicating that this will be a very important starting point for Brazilian guidelines, from Otávio Pieri. There is another question here from Professor Ekpo to Dr. Garber, please, again. He's asking for confirmation that the new schistosomiasis elimination strategy will include zoonotic schistosomiasis in control.
No, I think the guidelines is not providing a strategy. It's providing guidance on how to assess interruption of transmission by providing information on the diagnostic test to use when assessing the infection in snails, or when assessing the infection, evaluating the infection in non-human animals, for example. Yeah, but all of this is going to be part of a manual which is going to explain where to sample, how to sample, etc. But the guidelines just providing the guidance on the diagnostic test to use and the strategy to use for to combine this diagnostic test.
Thank you very much. We have a question from Dr. Sultani Matendachero, please, if you would like to come off mute.
Yeah, thank you, Susie. I hope you can hear me.
Yes.
I just wanted to maybe find out from Mariana. I think the presentation on the STH Coalition, a very good, a very good idea to help us, leverage some of the work that's going on, some of the technical expertise that's ongoing with regard to STH control. But at the same time, I also want to just hear from Antonio and Amadou, because there is the STH Coalition, then we have the STH Advisory Committee, which I have had the pleasure of serving on, which does a lot of work in terms of just being able to discuss around new trends and opportunities to improve on control and elimination. The other day, WHO came up with is actually working on establishing a committee on STH and Schisto. So I just wanted to know, what is the plan in terms of linking the existing advisory committee on STH, Global Schistosomiasis Alliance, this technical advisory group in WHO, maybe just to revisit so that we can be able to see how is it going to link, because I see an opportunity for the work that the experts have been doing to now be able to funnel a bit more into what WHO is doing, especially in terms of informing guideline formulation and informing policy. So maybe just a comment to be able to see how are we looking at it in terms of linking the already going, existing work to what WHO is thinking about. Thank you.
Dr. Antonio, Mariana, please, you answer first and then perhaps Dr. Antonio.
Yeah, definitely. Thank you, Dr. Sultani, for that comment. And one of the things that I know Susie touched on is that the Children Without Worms program is the Secretariat for the STH Coalition. And CWW is also the Secretariat for the STH Advisory Committee. And Dr. Paul Emerson and myself have been working very closely with Antonio as they have been starting this STH Schisto expert team. And one of the things that we both, from the side of the STH Advisory Committee, the STH Coalition, and then the new WHO STH Schisto Expert Committee, is that it's going to be very, very important for us to be all clear on the roles and responsibilities so that we actually complement rather than duplicate. And Antonio has been very supportive, and we hold monthly meetings, and I'll turn it over to him for any additional comments. Thank you.
Thank you, Mariana. Yes, I think, the STH and Schisto expert group in WHO is a formal group in the sense that there is an application, there is a review of the CV, there is a balance about gender and geographical origin of the participant. So it's a little bit more formal compared to the existing group in NGOs or in advisory group like Children Without Worms. So we are keeping the link. I think it's very, very important not to lose all the experience that have been produced by this group, but it will be a little bit more formal, and that we think that also the recommendation and the outcome will be more widely applicable, and not only for a certain group of country or people. So this is the idea, to having a balanced geographical representation in the group. But of course, we are trying to be as much as possible involve all the partners in this group. So is not exclusive thing, but try to involve as much as possible all the stakeholders in STH and Schisto.
Thank you very much, Mariana and Antonio and Dr. Sultani for your question. There's a question from Dr. Safari. Would you like to come off mute, please, and ask your question?
Yes, yes. So thank you so much. I have just a question, a bit of a comment, and this is directed to Dr. Amadou Gaba and Antonio. You speak very well about the plan for the coming activities. Particularly, it was clear about the plan for monitoring and evaluation of Schisto and STH in these countries. And then you mentioned something about precision mapping. Now, I understand as we go into the new roadmap, which is running from 2020-2030, a lot of activities had been implemented, but somehow we need to know where we are as we start the new roadmap. And that may mean maybe a bit of mapping or remapping. And I did not hear very clear about whether there will be new guidelines, because I understand these countries, like in Tanzania, last week we had an annual joint planning meeting, mapping. They were talking about changing strategy from district level implementation to ward level implementation. And this may mean a change in sampling strategies, a change maybe in how we get these samples, maybe not taking larger samples, but small samples in many units. Are there clear guidelines to guide the programs? Like, how do we go about the remapping? Because I feel like there needed to be remapping of the diseases. Will there be new guidelines for the precision mapping? I hear almost every country talking about the precision mapping. Are we going to use the same guidelines, or there will be new guidelines which will be released? So I wanted to hear clear about that one. Thank you so much.
Thank you, Safari, for this question. I think the reason you asked the question is maybe because I've not provided a slide on the planned activity. So this manual on remapping and impact assessment is a work that we started 2 years ago. We held several meetings and we came up with some protocols, some draft protocols that were to be implemented last year, but due to the COVID-19 pandemic, we are not being able to move forward with this field piloting of these new protocols for remapping. And at the same time, you have also colleagues that are working on an oversampling protocols to be used also for impact assessment. So it's ongoing work, and we think that when everything will resume, we'll be able to work together with the TAG and provide this new manual on remapping and impact assessment.
Okay.
But already we have some draft protocol that exists.
Good, that's great.
Thank you very much, Dr. Safari, for your question, and Dr. Amadou for your response there. The precision mapping one is a very popular topic also. There is a question from Susan Talbot in the chat to Dr. Montresor. Johnson & Johnson donated mebendazole directly to NGOs. Was this a COVID activity that will revert back to WHO donations?
Sorry, I didn't get the question. Well, if we get a donation of Johnson & Johnson to NGOs?
Johnson & Johnson donated mebendazole directly to NGOs. Was this a COVID-specific activity, or is this something that will revert back to donations to WHO?
So in my knowledge, the donation, we are receiving a donation of 200 million tablets from Johnson & Johnson. It's possible that some donation is done directly to NGOs, but let's say that 90%, 99% of the donation is going through WHO, and this is how we keep to mandate. This is very important for us to be able to understand the movement of drug in the different countries. If it's coming from many NGOs, or it's almost impossible for us to keep track on what is going on in each country. So we are trying to have request from a Ministry of Health directly to WHO, and then respond to this request. What we are recommending the NGOs, if they have area they are covering, is to get in contact with the manager, the program manager. The program manager will compile a request to WHO, a single request, and then when the drug are shipped to the country, the program manager will then divide and give some drug to one of the NGOs if this is very active, for example, in one region or one district.
Lovely. Thank you very much, Susan, for your question, and Dr. Antonio for your response. Rita Oguntoyindo, and I apologize if I have said this wrong. I can see that you have your hand up. Would you like to ask your question, please? That's Rita.
Yeah, Susie, she just turned the video on.
Oh, I'm sorry. Can you hear me?
Yes, we can. We can.
Yes. Yes. First, I'd like to thank Dr. Amadou and all of you giving us this update. I'd like to know if the new treatment protocol for SCH is starting soon, and do we have any idea? Because we need this to be able to plan.
About the STH guidelines or the schisto guidelines? So if the question is about the schisto guidelines, like I said, the publication is imminent, and we expect that the document to be released at the end of this month, so that countries can use it for implementation.
And regarding the STH, as mentioned, we are developing a protocol based on geostatistical approach to reduce the sample size. We are probably we will have a draft by the end of the year, but if one country want to, for example, field test, this draft will be very, very useful for us. So Rita, if you can send me an email, we can eventually, if this is your interest, we can discuss how to test, for example, this manual to understand if it's very easy and applicable in your country, if you intend to do this very soon.
Thank you very much, Rita, and Dr. Gabor and Dr. Montresor for your responses. There's a comment in the chat that was linked to the precision mapping from Fiona Fleming, indicating that Ghana will be the first of 4 countries for schistosomiasis oversampling surveys, which will start in less than 1 month's time. From the outputs of the schistosomiasis oversampling surveys, the WHO will be able to determine optimal and efficient survey designs for ministries to use for precision mapping. And there's a plug to please attend the core NTD session on this that Anouk has mentioned. We do have one last question. I apologize that there are some more coming in. It's been a very, very interesting session, but we have about 1 minute left for a question that's a very complex question. So this will have to be initial thoughts only. And it's a question from Mahensia, which is saying that we have learned that adolescents and women of reproductive age are going to be included or are being included. She is interested to know some of the strategies that are being used or in plan to engage these people in improving their own lives. So this is going to have to be a really short response. Antonio, I'm going to ask you for your response on this one, please.
Yes. As you know, for the control of STH in this age group, we don't have many resources. We were able to convince Johnson & Johnson to donate drug, to extend the donation of drug to preschool children and women of reproductive age. So something that was impossible a few years ago, so that all the donation we received was only for school-age children. Now we can use also another group at risk. Second, we do not expect much funding on this area, so we would like to use whatever is available to address this group. And first of all, is that if we have evidence that in an area there is a very strong transmission of STH, we don't need to do another survey on girl, but we will utilize the data from children to identify the area where to intervene. And then again, we are trying to use the already existing contact between the woman or reproductive age and the health system to provide this drug. And these are, for example, the prenatal visit, the postnatal visit, the vaccination for the child, or the HPV vaccination. And we are trying to launch this with a sort of leaflet that will be sent to all countries. We have a launch before the end of the year.
Thank you very much, Antonio. Thank you, everyone, for these very interesting questions and very informative responses. And I apologize if there's one or two that we are missing, and we shall try and loop back towards the end of this meeting to cover those. But for now, we shall need to move on to the second part of our meeting. This includes country presentations and an audience discussion on experiences in integrating and reporting on schistosomiasis and STH activities in NTD Master Plans. Now, we are quite aware that NTD Master Plans are a WHO Afro regional initiative, but for those countries which do not have a formal NTD Master Plan, we're simply meaning the strategic planning of activities and approaches towards 2030. For countries that maybe don't have schistosomiasis, this might mean initiatives to optimize STH activities integrated with other neglected tropical diseases, for example, with lymphatic filariasis activities, or with other initiatives such as vitamin A distribution or activities with the water, sanitation and hygiene sector. So whilst we do anticipate that discussion for our audience will mostly be integrated schistosomiasis and SCH, we also do encourage you to consider broader integration of activities and opportunities. There are a number of significant shifts in the approach to tackling neglected tropical diseases in the new WHO 2030 roadmap. As Amadou has mentioned, there are the 3 pillars in the roadmap: to accelerate programmatic action, to intensify cross-cutting approaches, and to change operating models and culture to facilitate country ownership. In concert with these, one of the most fundamental shifts has been to increase accountability by shifting focus on impact indicators instead of process indicators. And if I can please ask MYT to bring up the slide, you can see with the new targets for schistosomiasis and STH that they focus on impact, not simply achieving a certain level of preventive chemotherapy. So by way of a quick reminder, the indicators towards 2030 are as follows. For schistosomiasis, the number of countries validated for elimination as a public health problem, with that being defined as prevalence of less than 1% of heavy intensity infections. Also for schistosomiasis, the number of countries where absence of infection in humans has been validated. For soil-transmitted helminthiasis, the number of countries validated for elimination as a public health problem with the definition of less than 2% proportion of moderate and heavy intensity STH infections. And for soil-transmitted helminthiasis, again, the number of countries including ivermectin in preventive chemotherapy in all areas endemic for strongyloides cercoralis. This year, we have received a plethora of information in our fight against neglected tropical diseases, with the roadmap itself and accompanying documentation, such as the WHO 2021 to 2030 Monitoring and Evaluation Framework and the WHO 2021 to 2030 Sustainability Framework, to name but 2. Collectively, these documents bring great wealth of guidelines and recommendations to help us navigate the more complex NTD landscape towards 2030. So it is natural that right now, we look at all of this information, disease-specific and cross-cutting targets, and we ask ourselves, what does this mean? How do we systematically and consistently make decisions to work towards 2030? What do countries do? And with the large quantity of reporting milestones, including a periodic evaluation and World Health Assembly report on the roadmap to occur in 2022, followed by a full roadmap gap assessment in 2023, what are our first steps? As has been noted in these documents, clearer guidance is needed to enable countries to measure and monitor their approaches. This is an opportunity to synergize and work in partnership across the schistosomiasis and STH sectors. With this in mind, we are delighted to hear country program experiences today. So as I've indicated, we shall hear from Nigeria, Mali, and Tanzania, firstly on how they're integrating schistosomiasis and STH, how they aim to report on the schistosomiasis and STH roadmap targets, and whether they have any lessons learned or challenges identified from their planning. This will be followed by an interactive session. Our great hope is to facilitate communication and learning across countries, and so we encourage your active participation in the audience discussion. So I would now like to introduce Dr. Obiageli Nebe. She is the Deputy Director of the National Schistosomiasis and STH Elimination Program to present on behalf of Nigeria. Thank you very much, Dr. Nebe.
Good morning, colleagues. My name is Obiageli Nebe, a Deputy Director and Program Manager for the National Schistosomiasis and Soil-Transmitted Helminths Elimination Program, Federal Ministry of Health, Nigeria. Thank you so much, the organizers of this great workshop, for the opportunity given to me to share the Nigerian experience in designing work plans to meet schistosomiasis and SCH targets. The National Schistosomiasis Control Program was integrated with STH components as far back as in 2007 as one control program. The target population for the program are school-age children, 5 to 14 years of age, and other at-risk populations. The school and community platforms are used to deliver interventions to these at-risk groups. The National Schisto and STH Strategic Plan of Action 2021 to 2025 is in development with a focus on elimination of schistosomiasis and STH as public health problems. The plan was necessitated by the high disease burden, limited scope of interventions, low treatment coverage, and the critical need to align with the NTD Road Map 2021 to 2030, which WHO launched on the 28th of January 2021. What are the processes entailed in the development of this national strategic plan? It entails extensive consultations, meeting with key stakeholders, micro-planning meetings with states and the local government, the regional and the sub-regional levels. Then the plan will equally be fed into the future revisions of the Nigerian NTD Master Plan 2021 to 2025. The strategy is aimed at strengthening coordination across numerous partners and stakeholders under one plan, with agreed goals, objectives, output for success. It equally lays out the operational framework for activity guidelines that relevant stakeholders strive to achieve come 2025. There are also implementation guidelines that provide guidance on mass administration of medicines campaign, integrated vector management, water, sanitation and hygiene interventions, pharmaceutical supply chain management, monitoring and evaluation, advocacy, and resource mobilization strategies. There's equally a governance structure outlining the roles and responsibilities of all key stakeholders from federal, states, and local government down to the community. How do we report on schisto and STH activities? The reporting is in form of cascade. Both electronic and paper-based are being used in reporting the activities of the program. The primary source of the data is the school and community treatment registers, which are filled out at the point of medicine distribution by the community drug distributors and school teachers, who are the primary implementers. After the mass administration of medicine campaign, the number of medicines used, number of persons treated, and leftover medicines are documented accordingly. The information in the community and school treatment registers are summarized into the community and school summary forms by the frontline facility or zonal education supervisors, depending on where the treatments happened. The summary forms are quadruplicates. The community retains the original copy, and the other 3 copies are sent up the reverse cascade to the frontline facilities, the zonal education office, the local governments, and the states. Then the community and school summary forms are now used at the frontline or zonal education level to fill the reporting form at that level, and it's in 3 duplicates. The original copy remains at the frontline and zonal education office, while the others are sent up to the local government and state levels to the next level reporting. And the frontline summary is now sent up to the local governments, and the local government summary is in 2 copies. The LGA coordinator fills the LGA reporting form and returns the original and sends to the states the extra copy for preparation of the state summary. Then at the state uses information generated from the various levels to fill the Microsoft Excel. At this point is now soft copy. And information on treatment, the drugs used, number of persons treated are now compiled in the state summary, which is a soft copy, as I said, and is forwarded to the Federal Ministry of Health. The form is emailed to the MIE officers at the federal level and to fill WHO joint reporting form. The information is used to equally fill the joint request for special medicine, which the NTD program fills annually. The Federal Ministry of Health completes the joint reporting form with all the reports from the 30 states and the Federal Capital Territory, and a report is submitted to the World Health Organization, and a copy is, the soft copy is also maintained at the national database. What are the challenges and the lessons learned? There are several challenges, but I'm going to focus on 3 key challenges. One is the low national treatment coverage. Significant gaps still exist in the treatment of school-age children due to low scale-up of interventions in all endemic LGAs. For instance, the national treatment coverage still stands at 41% from the 2020 treatment record, far below the WHO benchmark of at least 75%. This is totally unacceptable for a program that is running an elimination agenda. Then limited scope of interventions, no form of snare control activities taking place currently, little water and sanitation interventions in all the endemic LGAs. Then non-prioritization of impact assessment of LGAs that have achieved 5 to 6 effective treatments coverage to determine progress made so far by the states and their supporting partners. All these challenges are pointers to the serious financial constraints the program is facing. What are the lessons? There's disaggregation of schistosomiasis and SA mapping data by WAS and migration from LGA to world-level implementation. And this has given room for more focal approaches, reduce under-treatment and over-treatment of communities, and improve the supply chain management system of the program. Recently, about 3 weeks ago, the national program was able to convene the Schisto and STH technical working group meeting, and the meeting was held both physical and virtually. And there was extensive deliberations and guidance and insights were provided for program and implementation activities. Also present in that meeting were members of the academia, NGO partners, WHO, AFRO, the Global Schistosomiasis Alliance, the MEC, the donors of Prazoquantel, the Evidence Nation, who actually supported that meeting, the End Fund, the Task Force for Global Health, and also the media. For the first time, the media was engaged in that meeting, and there was extensive publicity given to the program. And this is one of the things that we would like to continue. At this point, I want to sincerely thank you all for your attention.
Thank you very much, Dr. Neve. That was absolutely fascinating. We are going to move straight along to the next presentation, which is from Dr. Mahamadou Traoré. He is the National Schistosomiasis and Géo-helminthes Control Program Coordinator in Mali. Thank you very much, Dr. Mahamadou.
Je coupe, voilà, merci.
Okay, now it's working. Thank you. Good morning.
My name is Mahamadou Traoré. I'm coordinator, national coordinator for schistosomiasis and soil-transmitted helminths control program. For me, it is a real pleasure to share with you this afternoon the experience of Mali in the fight and SCH and STH. To understand how we did the STH on SCH integration, there are three points. First point is the political design. Mali has 5 PC entities covered by 4 programs. One of which is the National Schistosomiasis and Soil-Transmitted Helminths Control Program. This program was established in July 1996 with a mission to carry out action to reduce the prevalence rate of schistosomiasis, to increase the national coverage rate of staff with adequate function for care of patients, to integrate the fight against schistosomiasis and soil-transmitted the national primary health care system, to strengthen the minimum package. The second point is the integration. We have the existence of NTD Technical Coordination Committee and the integration at the national level for all the programs involved in the fight.
Hi, Dr. Traoré, could I just interrupt just for 1 second? I've just got a message from the French translator. Oui. If you could just speak, freely for us, and that the French interpretation will say what you're saying as you're saying it. So please carry on, but don't feel you need to wait for the interpretation to stop. Thank you.
Involved in the fight against entities with preventive therapy. We do mass drug administration under community directive against all PC. And we do also MDA against STH and LF with albendazole. The first point is the view of evaluation. We have the baseline survey in 2004, and we do also a survey of the impact of mass treatment. This is a survey of prevalence of infection and intensity of infection of schistosomiasis and soil-transmitted. So how we do this report? After an MDA campaign, a data review workshop is conducted at each level of the health pyramid. We have a health area, health district on the regional level, and we do also a national review of PC entities. Since 2015, STH and STH historical data have been recorded in an integrated database of entities and updated each year. Schistosomiasis and STH data review meetings were held in 2015, 2019, and 2021 with participation of international experts from the WHO, Global Schistosomiasis Alliance, FSA 316, and Ellen Keller International. And since 2020, SCH and STH indicator have been configured in the DIS2. So challenge and learned lessons. The top challenge are the update of cartography, training from laboratory technicians and doctors, and the collaboration with other sectors. Lesson learned, we have strengthening of MDA campaign supervision and advocacy and sensibilization. Thank you for your attention.
Thank you very much, Dr. Traoré. We really appreciate that, and we particularly appreciate that you presented in English and also that you waited for the translator to do the accompanying notes in French, so thank you. I'd now like to introduce Dr. George Kabona. He is the Program Manager of the Neglected Tropical Disease Control Program in Tanzania. Thank you, Dr. Kabona.
My name is Dr. George Kabona, NTD Program Manager, Tanzania Mainland. Today, briefly, I'm going to share with you how we have been designing our work plans in order to meet the schistosomiasis and STH control and elimination targets in Tanzania. Since the launching of Tanzania NTD program in the year 2009, the schistosomiasis and STH control program activities have been integrated with the other 3 PCTs, and therefore their work plans, implementation, and monitoring and evaluation of all the activities were done in an integrated way. And just to let you know, in Tanzania, if the endemicity of schistosomiasis and STH aggregated at district level, we remain with the 2 categories, high and moderate. And according to the WHO guideline for MDA implementation, there we have been having two options for MDA. One group with high endemicity are conducting MDA annually, and the other group of countries with a moderate endemicity are conducting MDA on alternate years. And they have been having more than 10 rounds of MDA in our country. Now, how are we conducting our planning? We usually have one annual plan and review meeting whereby we invite all the regional and district teams to discuss and review the previous year implementation and also plan for the following year. Now, from the year 2021, where we have the new roadmap, where we have the new set target for the country, and where we have the new master plan, we are now going to separate STH and STH program and treat them as a separate program, because at this level, two programs have different strategies in order to achieve their elimination targets. For example, for schistosomiasis, we are going to switch to a sub-district level implementation. That cannot happen with the STH, and therefore, just by having that difference, then they need to have different group of strategies. We have a number of targets which will be reported on the course of developing the work plans and also the implementation. And these are featured in our master plan. The first group of targets are working targets. And the second group is cross-cutting targets. And the third group is disease-specific targets. And the fourth one is health system strengthening targets. And the last one is vector control target. All of these are in line with the roadmap approach, where we need to have the country take the lead of the program and also own the implementation process. We have many challenges facing the program, but the top three are listed here. The first one is inadequate impact assessment. As I said, we have already conducted the mass drug administration with a good coverage for more than 10 years, and therefore we would like to know where we are. The second challenge is inadequate STH MDA. Our country is categorized as high endemic country, and therefore, according to the guideline, it deserves to have a 2 rounds of albendazole MDA annually. We have been investing the second round of MDA on LF MDA, and now it has been stopped in more than 90% cases, and therefore we are remaining with a reliable 1 round albendazole MDA. And the third challenge is having the disease-specific strategy document for schizo and STH. We need this so that it can guide the program on how to implement in order to achieve the elimination targets. And what we can learn from the Tanzania program, that we have established the expert advisory committee, and that has also shown to be a very important tool for the program to succeed. Thank you.
Thank you very much, Dr. Kabona, and thank you indeed to all of our country presenters. I feel that we have been very honoured to hear from you all tonight and to have you share your challenges, your experiences, your common themes with your planning and actions against schistosomiasis and STH. I found it personally very interesting to hear some of the commonalities, such as some of the issues around impact assessments, the importance of strengthening coordination, and as Dr. Kabona mentioned, the need for some of the disease-specific guidelines. These are all really important points. We do have just a few minutes that we can have for some questions and answers again. So may I please ask country presenters to turn on their videos for questions. I apologize, I'm not sure whether we have Dr. Kabona back in the room. And may I also again ask people to put their questions either into the chat or to raise your hand again. Thank you. Okay, thank you. In which case I might start with a question whilst people think of theirs. This is a question for each of you, so I might ask Dr. Nebe and then Dr. Traoré. Can you please indicate to us what have been your challenges around impact assessments for both diseases?
Hello. Yeah,
yes,
thank
we can
you,
hear
Susie.
you.
As I've said, thank you so much. As I said in my presentation, we have several challenges and the implementation of the SCH program. As I said, the two programs were integrated as far back as 2007 as one control program. Now we've moved to elimination that's still together. We have several challenges in program implementation. As I mentioned, one is we still have a lot of gaps when it comes to treatment coverage, where we have over 30 million SAC that are being targeted, and we're not able to reach even up to half of that. Is a huge problem. And also the issue of implementation of cross-cutting interventions like a WASH, we are still not yet there. And also the issue of assessments to be able to measure progress that we've achieved over the years. The funding issue is part of that, because if we're able to assess progress made by on the implementation units that are LGS have been treating for poorly achieved effective treatment coverage, we've not been able to do that assessment. So these are some of the problems, and all of these, as I said in my presentation, are all pointers to the financial problems that the program is facing. Let me stop at this point. Thank you.
Thank you, Dr. Nebe. Dr. Mahamadou, do you have any comments that you would like to add also? Oh, you're on mute.
Un commentaire par rapport au défi à
yes, a comment about this challenge. What our colleague has just said is very interesting, very important. As on the one hand, today we are all assessing this data within healthcare services. In 2021 in Mali, we started dealing with these matters in our healthcare system. And so this is extremely important assessment. And through the calculation of the average within each district, this can help understand what is preventing us from reaching out the population. And so reaching also that part of population which is, how could I say, more, I would say, representative of the actual population of the country. This is extremely important. So this is just something that I would like to add. Could you hear me?
Yes. Yes, thank you very much, Dr. Mahamadou. That was they were excellent points. We have a couple of questions for Tanzania, but unfortunately our Tanzanian program manager is not able to be with us just for this few minutes. There are some other questions, so I apologize. I'll move on to the more general questions, which I will ask once again Dr. Nebe and then Dr. Mahamadou. And there's a question from Oluwole Afolayan. How do you calculate national coverage?
Can you hear me?
Yes.
Yeah, thank you, Dr. Akiola, for that very important question. We calculate the national coverage based on the number of persons targeted within all endemic LGS that are treated. Then total number of persons treated over the total targeted. That's how you calculate the national coverage. I hope I've answered your question. Total number targeted, total treated over total targeted.
Yeah, thank you. Merci pour la question.
Thank you for this question. Is it okay with your answer? Dr. Neighbor, do you have anything to add? Okay, so thank you for your question. The national coverage in Mali is calculated for school-age children, and that are a big percentage of the total population. So the number of children treated compared to a specific goal gives us the actual coverage of the whole population. Thank you for your question.
Thank you very much. Thank you both for your answers. There's a question here. I'll do two last questions. There's a question here from Agencia Navirio. Have the presenters discovered differences in progress of the two diseases in any way? So could better performance be in controlling one disease compared to the other? Do you have any comments, Dr. Nebe and then Dr. Traore?
Thank you for that question. Actually, there are differences between the two diseases, the progress made. For instance, schisto, is only prazoquinone that is being used to treat for schistosomiasis. So whatever you treated or whatever that you achieve is based on that alone. But for SCH, if you treat, you treat with albendazole, where STH and LF are co-endemic, and also where it is only STH that is endemic for the community or for the local government, you treat with only mebendazole. So even with the STH treatment that is benefiting from LF treatment, you find out that in most cases, the coverage for STH is much higher. If you see in my presentation, I said that national coverage is for schisto, but for STH is quite over 60%. So there's a lot of difference between the progress made because of the LFMDA that is STH is benefiting from.
Thank you. Dr. Mahamadou, do you have any comments also?
Oui.
Yes.
Oui, merci pour la question.
Thank you.
Thank you very much for your question. Actually, I believe that there is a slight difference because, as I have already mentioned in my presentation, the point is to maybe focus on the specific parts related to FL. So in 2004, we started with the first evaluation. Only in 10 districts did we say a coverage over 20%, so that would make them eligible for treatment. Albendazole, for example, was implied. So we managed to lower it down to 2%, which is what is recommended to stop a mass treatment. So this is what we did in Mali. So we stopped this type of treatment mass treatment, if you will. But since it is this type of disease, we know that there are some environmental as well as behavioral aspects to be taken into account when it comes to families as well. Because practically, the way people behave are not always the best possible ones in terms of their hygiene or the fact that they may or may not use the infected areas when it comes to toilets, for example. So everything must be disinfected. It's true that we've been progressing in the fight against those two diseases and schisto in particular. But in terms of coverage, there is not such a big difference, because from a therapeutic approach viewpoint, we've always been over 80%. And this in a situation which is not safe at all. Great uncertainty as well. So people needed to come to us to look for the treatments. That is how we started developing a strategy to put forth this mass strategy. So that is more or less what has happened over the past few years, so that we could get over this 80%.
Excellent. Thank you very much for the questions. Thank you for the very, very useful responses. I know that we've had some more questions put into the chat that unfortunately we won't have time to do today, but I'm sure that people will look into these, and there's a couple of specific ones that people might like to separately loop and talk about after this meeting. We're going to quickly move on to our interactive component, and we hope this will be vibrant. It will be quite short to capture more thoughts on what has been presented and what might apply in your countries. So may I please now ask for the Easy Retro board link to be shared in our chat and also placed on the screen. And can I please ask all audience members to click on the link in the chat and open the Easy Retro board on your own screens. Just whilst you are doing that, Easy Retro is a real-time interactive board where we can compile your answers to the 3 questions that we have posed. You can add a response to any question on the board by simply clicking the plus sign under the question. Please make sure that once you have finished typing your response, you then click the tick to upload your response. The 3 questions that we ask for you to provide responses to are: how do we effectively integrate schistosomiasis and STH into NTD Master Planning? How can countries report on progress to schisto and STH targets? And what are the key challenges or concerns or learnings in measuring progress towards these targets? You may provide your answers in French or English, and the answers are anonymous. So please spend a few minutes inserting your thoughts onto the Easy Retro. Just in brief, it looks like there's a very rich discussion happening at the moment, and a number of key issues are happening, including the ones we've talked about regarding impact assessments, are some indications regarding further defining, further clarifying some of these targets and what they mean. There's messages coming through about the importance of integration, particularly we're seeing the lymphatic filariasis SCH integration theme coming through, but also integration. I've seen a number of ones about integrating with some of the other NTDs and some of the WASH sector. So some very, very useful and important things being captured. We've tried to have 1 or 2 of our panel sign out of the Easy Retro to hopefully enable a few other people to pop on in. So please retry if you weren't able to get on the board the first time, but otherwise please do feel free to add your comments, and we absolutely will go through these and welcome the comments over the next couple of days. So And just in the interest of time, please keep typing into the board, and I'll just give my final overview summary to start bringing the meeting towards its conclusion. The WHO does clearly acknowledge that the 2021 to 2030 documents are living documents, and we do know we do need to do some work to determine how to address these challenges in a holistic and country-focused way. Between now and 2030, we can absolutely expect NTD programs to evolve. So it is unsurprising at this time that we are seeing numerous challenges. We can see from 2030 targets that schistosomiasis and STH have different definitions of elimination as a public health problem. We can see addition of Strongyloides stercoralis to the STH cadre. Further, we can see that targets themselves do not specify changes to at-risk groups, although other documentation clearly recommends preventive chemotherapy to at-risk groups, such as women of reproductive age against STH. We have heard WHO's priority consideration of this in Dr. Montresel's presentation, and it does seem that treating women of reproductive age may not be conducted in a mass drug administration campaign style of approach. We can further see, as is coming through clearly, that to achieve roadmap targets based on impact indicators will require monitoring and evaluation approaches to enable evidence-based decision-making and reporting that aligns with country priorities and country policies. We will have work to do on a range of programmatic and monitoring and evaluation strategies, including improved mapping to support mass drug administration at lower administrative levels, impact assessments allowing country strategy adjustment with building of capacity for these technical activities into countries, improved data quality and integration of monitoring and evaluation activities into national health information systems, quantification of the burden and implementation guidance for Strongyloides stercoralis preventive chemotherapy, and additional implementation guidance, I should say, on reaching expanded at-risk groups. We have heard that the WHO is acknowledging and working on this. For schistosomiasis, as Dr. Garber has advised, a working group has been developing new guidance for the monitoring and evaluation, including integrated strategies, granular mapping, and impact assessments. For STH, the WHO is developing a monitoring and evaluation framework, providing more guidance on what to do after successive use of preventive chemotherapy. An important piece of work for us is to articulate these gaps and challenges that we are facing, as well as any identified ways forward, so that we can feed into this work being undertaken by the WHO in a helpful and non-duplicative way. Lastly, and overarching, the WHO is in the final stages of establishing its new technical advisory group on schistosomiasis and soil-transmitted helminthiasis control and elimination. Without a doubt, this new body will take up the reins on the myriad issues and provide expert guidance and leadership for us all. So there is much hope, and I reiterate, much opportunity looking forward as we all put our best efforts towards supporting country-led decision-making and achieving these paradigm shifts that have been set out in the WHO roadmap. This does bring the main part of our meeting to an end, and I shall now hand over to our incoming chair, Dr. Anouk Gouvras, to provide final remarks and formally close. Thank you so very much, everyone, and thank you, Dr. Anouk.
Thank you, Susie. Hi, everyone, and what a great meeting we've had so far. Sad that it is ending, but there we go. Some good things do have to come to an end. I would just like us all to acknowledge the wonderful job that Susie has done of planning and leading this meeting and of bringing the NNN Schistosomiasis and STH Disease-Specific group together. So thank you, Susie, from all of us, and I look forward to continuing to work with you now that you take on the role of past chair. I'm really honored to take on this role of chairing this group. The ethos of the NNN to work in partnership across diseases and sectors and to share learnings, best practices, and problem-solve challenges together is something I'm very passionate about, almost as much as I'm passionate about schistosomes and STHs themselves. As incoming chair of this group, it is my task to announce the incoming vice chair, and I am delighted to say that Mariana Stevens has been nominated to take on this role, and I am very much looking forward to working with her in the next year, building and leveraging this group as the forum that brings together stakeholders for both diseases. As Susie highlighted earlier, we have had an eventful year in the NTD sector with the focus on building back better in the context of the pandemic, the launch of the new WHO Road Map, and the plethora of information and guidance contained in the links, in the linking documents and the publications that will be coming out shortly. There is a clear call to action, and here is the opportunity for us to look at how we can use this group to rise to the challenge and contribute to the elimination of schistosomiasis and STH. There are a few things that I would particularly like to focus on over the next year in order to strengthen this group as the forum that brings together NGOs and other stakeholder groups working on schistosomiasis and on STHs, and to ensure that what we do is indeed supporting national plans as we make these fundamental shifts outlined in the WHO roadmap. Firstly, I'd like to look at rebuilding the membership of this group. You will have seen when you signed up to this meeting that we asked you whether you would be willing to be contacted by this group. We hope to use this created mailing list to ask some questions and establish a list of members for this disease-specific group. And we particularly would like to look at the composition of this membership. Who are we missing? Who do we need to engage with? Secondly, we'd like to review the objectives and the remit of this group. Let's review our objectives in light of the new roadmap and in light of the soon to be formed WHO Schisto and STH Technical Advisory Group to make sure we are using our NNN forum efficiently and effectively. Thirdly, I'd just like to rethink a little bit our communication and engagement strategy for this group. How should we do this? Do we need a dedicated mailing list to increase information sharing across this, the stakeholders here? How should the disease coalitions engage with this group, and how often should we meet as a group? What opportunities can we leverage to bring stakeholders from these two diseases together? So I hope you have all ticked yes to being contacted. Your feedback and advice will be key in guiding and defining how this group moves forward. Finally, Mariana and I would like to invite you to start thinking about whether or not you would be interested in the vice chair role of this group for the next year. We welcome all those interested, of course, but we particularly like to encourage interested individuals that are from schistosomiasis and STH endemic countries. We recognize that to bring about the change highlighted by the very theme of this year's NNN conference, enabling a paradigm shift to a country-led response to deliver the NTD Road Map, which is of course based on that all-important third pillar of the WHO NTD Road Map, we need to address certain imbalances that exist in the global health sector. I don't know if you were able to attend the NNN special session today on walking the talk on country ownership towards a paradigm shift in global health operations. I highly recommend you watch the recordings of this session as it highlights some of the work the NNN needs and wants to do in terms of its membership and leadership, particularly growing membership and leadership from the global south. Which is why we would like the NNN Schisto-STH Disease-Specific group to be contributing to this change, and why we're looking at the membership of this group as well as future chairing of this group. So please do consider putting yourself forward for vice chair role for next year. It is a great opportunity to guide the work of this global group, and you will have the support of Mariana and myself when we take on the role of chair and past chair in next September. So please do email us. Mariana, just wanted to say if you wanted to say any words, give you the opportunity.
Thank you so much, Anouk. And again, thank you, Susie, and the committee. I'm just really honored to come in and serve as vice chair, and I look forward to working with you all on a wonderful new year. I know I do sit at the STH Coalition on a professional note. on a personal note, I have had schistosomiasis, so I think that I will bring both of the diseases together. So I look forward to working with everyone. Again, another reminder, if you're interested in joining this disease-specific group, please email and let us know, and we'll definitely make sure you join. Thank you guys so much.
Thanks, Mariana, and thank you everyone for the stimulating discussions and contributions. A special thanks to the MYT team, particularly to Janine, Nick, and Russell, and to the talented interpreters and captioners of our session. We are very grateful for your work and guidance in making this meeting a success. Everyone have a great day, and I look forward to future discussions with you all. Thank you.
Thank you, everybody, for joining us today. We will just let you say your thank yous, and then we will close the meeting shortly. Thank you, everybody, for attending today. Have a good rest of your day.
Thank you. Bye.
Okay. Bye. Thank you.
Bye. Thank you.